Keppra is an antiepileptic drug available as 250 mg, 500 mg, 750 mg, and 1000 mg tablets, and as a clear, colorless, grape-flavored liquid for oral administration. The active ingredient of Keppra is Levetiracetam. What is Keppra and what is it used for? Keppra belongs to a class of drugs called anticonvulsants. Keppra is a prescription medicine used to treat the symptoms of partial onset seizures, tonic-clonic seizures, and myoclonic seizures. Keppra may be used alone or with other medications. How to use Keppra? Take the liquid and regular release tablets by mouth as directed by your doctor, usually twice daily with or without food. Crushing or chewing the tablet may cause a bitter taste. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device spoon. Do not use a household spoon, because you may not get the correct dose. If you are using the extended release tablets, take this medication as directed by your doctor, usually once daily. Do not crush or chew extended release tablets. Doing so can release all of the drug at once, increasing the risk of side effects. Do not split tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. The dosage is based on your medical condition and response to treatment. The dosage in children is also based on weight. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not stop taking this medication without consulting your doctor. Your seizures may become worse when the drug is suddenly stopped. Your dose should be gradually decreased. Tell your doctor if your seizures lasts, change, or gets worse. Here are some things to know before using Keppra. Before taking Levetiracetam, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history, especially of kidney disease, mental mood disorders. This drug may make you dizzy or drowsy, especially during the first month of treatment. Alcohol or marijuana can make you more dizzy or drowsy. Do not drive, use machinery, ride a bicycle, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Talk to your doctor if you are using marijuana. Before having surgery, tell your doctor or dentist about all the products you use. Children may be more sensitive to the side effects of the drug, especially mental mood changes. Children younger than 4 years may be at greater risk for increased blood pressure while using this drug. Older adults may be more sensitive to the side effects of this drug, especially drowsiness, dizziness, or loss of coordination. These side effects can increase the risk of falling. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This medication passes into breast milk. Consult your doctor before breastfeeding. What are the side effects of Keppra? Drowsiness, dizziness, unusual tiredness, or weakness may occur. These side effects are more common during the first 4 weeks and usually lessen as your body adjusts to the medication. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Tell your doctor right away if you have any serious side effects, such as loss of coordination, mental mood changes, signs of infection, signs of anemia, easy bruising, bleeding. If this video was useful for you, you can subscribe to the channel for support and like the video. I wish you healthy days.